Audio Jungle.
Fluvoxamine is a selective serotonin reuptake inhibitor. It's used for a myriad of conditions, including generalized anxiety disorder and depression. It's approved by the Therapeutic Goods Administration on the 1st of April 1997, and that was no April Fool's. For some, it is an answer to their problems. However, what happens when things go wrong? Ladies and gentlemen, welcome to another episode of But Did You Die? I'm your host, Bond Rogan here. Today we have Stacey's mum and her daughter Stacey with us. Stacey's mum?
So basically, Stacey suffered from anxiety for years, and the cognitive behavioural therapy that they said would help her hardly helps at all. She's a nervous wreck all the time. The doctor gave her some tablets, and she ended up in hospital 2 days later.
So I felt very agitated, and I had shivering and these tremors as well. They told me I had a high fever apparently, and my heart rate was also very fast.
Okay, that's okay. You don't need to talk anymore. So basically, instead of helping her, the pills just made everything worse. They made her more anxious. She was confused. Her pupils were huge, and her muscles started to go all stiff.
Stiff. That kind of sounds like when I take some pills. Okay, so let's hear from the doctor now. Dr. Risky is in the house.
Yeah, one second.
Awkward moments.
Yeah.
So doctor, you want to fill us in?
Well, hello ladies and gentlemen in the audience and everyone in the home watching. Now, what happened was I prescribed fluvoxamine 50 milligrams daily to take in the morning with some food, with a view to increase it up to 300 milligrams daily if needed. Now, serotonin toxicity only occurs in 15% of the population when it's ingested and presents with a triad of symptoms. These are neuromuscular excitation, which functions with nerve, autonomic effects, central nervous system effects. Now, unfortunately, I had no idea this was going to happen, but Stacey presented with all these symptoms. Now, if serotonin toxicity is not treated, it can progress to multi-organ failures in hours even. Now, she was withdrawn from the drug as recommended by my dear friend, the pharmacist, and given cyproheptadine 12 milligrams orally as a single dose. Now, the pharmacist also suggested to me that she could take, benzodiazepine, was it? Yes, benzodiazepine. But it wasn't necessary, you know? I felt it wasn't necessary to take. Now, after about 8 hours, she was discharged and she was on her way home. I don't see what the problem is.
Well, thanks to the insight, Dr. Risky. I wouldn't mind a few of those benzos myself, actually.
Let me know.
Alright, sounds good. Now, so to continue this controversial topic, we'll move on to pharmacists.
Hi guys, I'm a pharmacist. The dose that Dr. Risky prescribed is the recommended starting dose according to the resources. However, it may not necessarily be appropriate for all patients, and this is the case in Stacey's case.
What do you mean?
Well, you see, the Australian Medicines Handbook recommends starting with half the normal dose for the management of anxiety disorders and avoiding high doses as anxiety may actually be exacerbated. That means it can get worse. She should have been started on 25 milligrams daily, not 50 milligrams.
No. You're trying to tell me what to prescribe and not prescribe?
That's exactly what I'm doing. Now, to make matters worse, I believe that Stacey may be a poor metabolizer of an enzyme called CYP2D6. So 5 to 10% of patients are poor metabolizers. CYP2D6 is responsible for the breaking down of the fluvoxamine in the body. It does this in the liver by oxidative demethylation and deamination. If a patient is a poor metabolizer, this results in higher plasma concentrations that can increase the probability of side effects and the chances of serotonin toxicity, which is what we believe Stacey experienced. So patients can undergo genetic testing to see what kind of metabolizer they are. They are considered to be a poor metabolizer if they carry certain alleles. So that's the 3-4, 4-4, 5-5, or 5-6 alleles.
So English, please.
So what I'm basically saying is that if the results show that she is one of these types, it is recommended that the patient be started on a 25 to 50% lower dose than the normal starting dose. The dose can then be titrated up to a suitable response, and when that is achieved, we stick with that dose. So in the future, Dr. Risky may want to consider genotypic testing of his patients for a panel of 450 genes prior to commencement of the treatment.
So wait, you're telling me a doctor who's gone through medical school, do you know how those tests are and how much information we've gone through, that I missed this? No, I couldn't.
You did.
No.
It's right there.
No, look at her. Look at her. Look, she's shaking.
Well, gentlemen, I'm sure you guys can sort this out outside afterwards.
We will.
Yeah, so,
Anyway, boys, so basically you're saying that Stacey can have her dose reduced to 25 milligrams instead of 50 milligrams and she won't get these side effects and it will help her anxiety? Doctor?
We can't guarantee that she won't experience any side effects, but it will be less likely. So some common side effects to be aware of are mild agitation, gastrointestinal side effects, insomnia if taken in the evening, dizziness, and sedation. So how does that sound, Stacey?
I'll let you try it.
Is that okay with you, Doc?
Well, I'm not one to, put my head down and admit defeat, but this is something I would like to try. We would probably test your CP450 gene profile first. Then we can decide further on what we can do from now on, and probably lower the dose and go from there.
Well, that sounds fair, I think.
okay, folks, well, that's all we have time for today. I'd like to thank our guests, Stacey's mum, Stacey, Dr. Risky, and the pharmacist. So let's find out how this case progresses in a week and find out if she dies in the next episode of But Do You Die? This is Bon Rogandy signing off. Stay classy.